I'd like to welcome everybody. Thank you very much for joining the Grameen Foundation update on our COVID-19 emergency relief response globally. I'd like to thank my team, in particular Kate and Princia, for bringing us all together. Thank you for joining us. And I hope many of you were also able to connect in our last webcast, which was April 2nd. So first of all, I'd also like to give a special welcome to those joining us from the Capital Group, as well as from the National Quality Forum. Both organizations we're very proud to have great associations with, and we're so grateful for your support and your interest and encouragement always, and particularly at this time. The goal of this call is essentially twofold. We want to bring to you voices of our leadership from various in-country staff to provide you with insights on what's happening around the world related to the current pandemic. And we also want to provide an update on our response in some of the poorest communities in the world that we serve, right? Obviously, our first and foremost concern has always been, to ensure that our staff and their families are safe and healthy. And we've spent a lot of time and effort on that, needless to say. And, we've also been very fortunate to take advantage of a lot of expertise that we have in Grameen to make sure that our response is appropriate for the moment. For those of you who are new to Grameen Foundation, essentially we utilize mobile phone technology and place it in the hands of the poorest people on earth, in particular women, as a way of combating global poverty. And this helps to expand financial services, agricultural production, ensure food security, and provide access to information related to health and data that's applied for health. We've been working with technology and mobile technology in various platforms in some of the remotest areas in the world for some time now. And frankly, this has become an important asset for us at the moment. So, adapting to some of the changes related to using mobile phones and using things like Zoom, maybe for us is a little less difficult than it has been for others. So we're very adept at it. And thank you for all joining on this platform. Essentially, we recruit and train women largely in villages who become agents for providing information, financial services, agricultural services, etc. And since our inception, we've trained and supported in excess of 300,000 agents in a variety of countries. And they provide access to financial services, agricultural information, and support, as I mentioned, health information. And these are a lifeline always, but increasingly now they're a lifeline to vital information and services to reach the poorest people during this difficult period. Last month, we announced a COVID-19 emergency relief effort, and reports on the increasing stress that is being seen globally on the health systems, on the individual health, on the livelihoods of the poorest in the world, and on what's happening within the microfinance and microfinance sector globally. These are all sources of real alarm for us and raise a heightened level of concern about what's happening, to our clients and the poorest people on earth that we serve. But as I mentioned, mobile technology helps us to educate, helps us to identify who is most in need, and it helps us to provide the right kind of support at this difficult time. And we're gearing up our work now to provide immediate cash transfers to those in need. We're providing non-cash relief in a number of circumstances related to basic foods and medicine packages. And believe me, our ability to use mobile technology is a key enabler to this work. So we've launched programs in India, in the Philippines, and in Uganda, and we have plans to expand this work as it's going to be much needed in the coming months. In India, we've equipped our community agents, we call them Grameen Mitras in India, which means village friend, to continue providing financial services and cash transfers to their clients. And we're going to hear from Prabhat Lab about that work. In the Philippines, we're working to provide non-cash relief assistance in the form of basic food and medicine packages, alongside COVID-19 crisis-related financial advice that helps micro entrepreneurs and their households. And we're starting work in refugee communities and camps in Uganda. We're also moving forward to use our health-related technology platforms, which we previously used to combat Ebola, to employing it to address the COVID-19 emergency as it unfolds more widely in Africa. So your support and donations have made this possible, and we're extremely grateful for that support. As I mentioned, it's allowed us to have thousands of community agents already in place supporting their communities in a variety of ways. And they have an amazing ability to reach out to their neighbors. One agent globally reaches out to in excess of 150 individuals of support for what they do. So any support that you can continue to provide to help us support these agents, support their communities at this unprecedented time, is precious to us at the moment. So please see our website for that, www.grameenfoundation.org. We know that many of you want to help, and please help us if you can, and share the stories that you're going to hear today and the stories that you will see on our website. So you too can be a part of this bigger solution to the mounting problems that we're seeing. Thank you very much for your support. Now, I'd like to turn to some of our experts at Grameen Foundation to share some of their insights. First, I'd like to welcome Prabhat Lab, who is based in the New Delhi area. He's our CEO for Grameen Foundation India. Prabhat, can you give us a little bit of an update on what the lockdown in India is like at the moment?
Thank you, Steve, and good morning, good afternoon, good evening to everyone on this webinar. Thank you for joining us. In India, now we have completed about 6 weeks in the lockdown and in the third phase of lockdown, which has been further extended until 17th of May. And even now, we are seeing an increasing number in the infections, which is increasing every day. Over 50,000 people have been infected so far, around 16,000 have recovered. So if you look at India, a country of the size of India, with a population of 1.3 billion, of course, that number is not huge as a proportion of the population. But in India, the key thing is that one is the health crisis, the coronavirus crisis. But the even bigger challenge is the economic crisis, which has resulted due to this health crisis. So due to this national lockdown, which has just froze all the economic activity around the country, we have seen suddenly our unemployment rate shoot up from about 6% to 27%, which means that 127 million people are now unemployed, which is around 1/4 of, so 27% of our workforce. And it's not just people working in the informal sector. Of course, the informal sector is the largest employment generator in India, and those activities are completely frozen. But even there are job losses you can see in the formal sector, among the salaried, amongst the self-employed. Even for the farmers engaged in farming practices, while there have been some relaxations for agricultural activities, it's difficult for the farmers to get their produce to the markets, especially for perishable commodities such as fruits and vegetables. It means that they cannot sell and they cannot earn from the produce. So it's created immense amount of hardship for people in general. We have a very large migrant population and population of migrant workers who migrate from rural to urban areas for work, and suddenly they were left unemployed and stuck. So it is affecting a very, very large number of people all over the country. The government has done some measures, like it has started giving free food like rice and wheat under the public distribution system to the low-income families. It is also giving 500 rupees, which is about $7, to all the holders of the Jan Dhan account, which is the accounts held by most of the low-income people in India. And it is also announced that all the poor households will receive 3 cooking gas cylinders over the next 3 months, free of cost. But all these measures are quite inadequate, given the fact that suddenly you have incomes have stopped and there's no livelihood activities. there was a survey of the micro and small enterprise conducted, which sees that almost 47% of the micro and small enterprises are already out of cash. So they don't have any liquidity left, or they will run out of liquidity this month, in the month of May. So it's a huge problem, and we need to respond to that.
Yeah. Well, thanks so much. Tell us a little bit, about how the pandemic is affecting your work and the work of the Mitras, the Grameen Mitras. How are you all responding to these challenges?
Right. So, of course, one good thing is that all the Grameen staff and the Grameen Mitras, our village agents, are none of them have faced any health challenges so far. The staff in the Grameen headquarters in Delhi, they all continue to work very effectively, working remotely, working from their home. But of course, our field work is impacted, various projects that we implement in the field, so we can't conduct trainings and recruitment of more agents. One good thing that also happened is that because our Grameen Mitras, they are offering banking and financial services, which is considered as an essential service. So they can continue to offer valuable banking services to people in the remote rural areas, things like cash withdrawal, mobile phone top-up, money transfer, those kind of things. Grameen Foundation has started its unconditional cash transfer program in one state in India, which is Bihar, in the Nevada district, where we are trying to identify some of the poorest of the poor, people facing multiple vulnerabilities. So our effort is to look at those households which are not only poor economically, but also are facing social vulnerability due to social factors, such as maybe they have a disabled person at home, maybe they have orphan children at home, maybe they lost their jobs because of a migrant crisis, or they have an old age person at home. So we are looking at these multiple sources of vulnerability. We have developed a mobile application called Grameen for Giving, so which is used for end-to-end process management, right from the beneficiary identification to uploading the profile of the beneficiary on this mobile online system. And then we have an algorithm which looks at their vulnerability on account of these multiple parameters, comes up with the vulnerability index, and recommends the beneficiaries who can be eligible to receive the unconditional cash transfer that we are offering. Then we have a selection committee which meets and decides, which ones we should really support, because we really want to reach out to the most vulnerable and poorest segments. And once the selection committee makes the decision, then we send out the cash transfer directly to the bank account of all the beneficiaries. And then we have also tied up with bank mitras or bank agents in the villages. So when the beneficiary bank account gets credited, we get in touch with the bank agents, and they visit the household, the doorstep of the beneficiary, and gives the beneficiary an option to withdraw cash from their bank account right at their doorstep. Because for people in the villages, it's very difficult to travel to the bank branches, which may be far away, and there's no public transportation working. So it's been really an immensely impactful and powerful program because of its robust design, and also because it can work so quickly. Within 2 days of a beneficiary being identified, we are able to send the money in their hands, which even people are really amazed as to how come things are happening so fast. So yeah, I mean, we feel very, very grateful that we have been given this opportunity to serve some of the most vulnerable people. Somebody who lost his job as a migrant worker, somebody who is an old person, is paralyzed, was receiving income from some relative in the city who is not able to send remittance anymore, somebody who was mowing grass and selling that in the marketplace but can't do that activity anymore. Those kind of really, really poor people who are beneficiaries of this program.
Thanks so much, Brad. And these are, I mean, relatively modest amounts of money. This is only about what, $35 or so that you're transferring. What difference do you see it making to people?
So yes, we are transferring about $35 a month, and we'll be doing that over the next 3 months. So that's an immense help for those households. I mean, it guarantees their food security for these 3 months. And not only that, in case they're receiving food from the government, they have the option, they have the power decide if they want to spend that to get healthcare, buy medicines, or they want to invest the money in restarting their small business, which they had to close down and they have run out of their working capital. So yeah, I mean, there are multiple ways we are seeing the households can benefit. And definitely that's one of the profound things about an unconditional cash transfer program, because it gives power in the hand of the recipient that they can decide. They have the power to decide where and how they want to use that money. So it really takes care of their vulnerability. It makes them resilient, and it makes them hopeful that, okay, we are not alone. There's somebody out there to help us.
Yeah, great. Prabhat, thank you so much for all of your leadership and also being awake at such a late hour in India. But I just want everybody to know, what a fabulous leader you are for our program in India. And thank you again. I'd like to turn now to another, frankly, extremely fabulous leader who we have in the Philippines. Christine Vialago is our country manager there. She spoke with you all last month. Again, Christine is up at a very late hour, but she's been an absolute dynamo of leadership, of support to staff at difficult times, and of crafting a very, very important response in Philippines. So, Christine, could you please give us an update on what's happening in the Philippines?
Sure. Thanks, Steve. And thank you everyone for joining this call and for allowing us to share about our work as well here in the Philippines. Maybe I can give a brief update what's happening in Asia, what's happening in the Philippines. For the Philippines, we're currently still implementing an enhanced community quarantine, which is expected to last about until mid-May, so May 15th. This is especially for high-risk areas, including Metro Manila, Central Luzon, and big cities like Cebu and Davao, which are high-dense population, cities with high-dense population, and can be considered areas with high number of cases. So we are actually in total number of cases, we're at 10,343. The good news is our number of recoveries are increasing more than the deaths. So the recovery rate now is at 1,618 and the deaths are 685. But because of the quarantine situation, there are a lot of restrictions happening in terms of movement. So for example, we are on a full travel ban. There's no land, sea, and air travel. So there's no local transportation. It's to help curb and to make sure that social distancing is in proper place, and each municipality provides additional notices or guidelines for villagers. So like, for example, in our local village, we're only allowed to get out of our houses with the use of a pass or quarantine for one person per household to access essentials such as food, water, medicine, and to basically to go out in the grocery store. And the local government have also started to distribute food packages, basic medicines, and cash to the most vulnerable and registered indigent groups per village. So this includes senior citizens and their previous beneficiaries of the conditional cash transfer. So that is continuing and increasing. And even small entrepreneurs and micro entrepreneurs can start to register to the local government so that they can ask for subsidy for the next few weeks. So the beneficiaries usually get about an average about 4,000 to 8,000 pesos. So a little bit of about $100, which is usually good for a month, and then they get another round. If they're lucky enough, they get another round for the next month. For areas that are low risk, they consider that as what we call the general community quarantine areas. Only folks that they're more relaxed in terms of movement, and only folks that are in the ages of 21 to 59 years old can go out of the house and access the supplies and basic needs. But I think what is nice in terms of being present in Asia is that we're also learning about stories of hope from other countries. If you look at it now stories from Hong Kong, Taiwan, Singapore, and even South Korea, they're really slowly flattening the curve and reporting less cases. And from what we see, the crucial activities that they put in place really include mass testing, contact testing, and tracing, and using mobile data and information to track the movement of people. And they're slowly, easily going back to regular business days, but with relaxed quarantine situation. And even though there's no lockdown, people are still very respectful of the behavior of social distancing
Right.
and moving around
Great.
in places for safety.
Yeah. Thanks so much, Christine. Tell us a little bit more about how it's impacting your work and what steps you've been taking in the Philippines to respond.
Yeah, sure. So in the Philippines, we're also seeing that there are a lot of various organizations and individuals that are initiating respond efforts. So from delivering food to frontliners, health kits, and mass distributions, these are small steps by individuals and organizations. And us as well in Grameen Foundation, we are happy to say that we are responding to this by providing and launching our unconditional cash transfer support program. We are working towards partnerships with local microfinance institutions to provide immediate relief to women, groups, and smallholder farmers. So what we're learning is that these individuals who are experiencing COVID-19 in their local villages as well are those who have also experienced a certain shock. It can, as a disaster-prone country, most of our groups have experienced either an environmental shock, such as a typhoon, natural disaster, even a volcano eruption, and even drought. It's already summer here, and as of today, we recorded 44 degrees. And these conditions actually complicate the situations of women groups and farmers. So the unconditional cash transfer that we launched, it is really comes to a very important time, as it provides immediate relief to those who need it the most. In terms of our work with community agents, we're seeing that because of the restrictions of movement, these agents have either an increase in foot traffic from their local villagers because they are now able to provide the transactions that that they need to do at the moment, including remittances, local remittances, even purchase of airtime or load, and payment of your utility bills. So by transacting for the agent, they don't have to go far for another hour, or in this case, probably more than an hour, because there's no local transportation. They would have to walk it. And by just going to the local village, it saves them that time and effort to do so. We've also been hearing stories of unique stories from our agents. And I think one of the good stories to share is the one of Jenny, who was a community agent who've been working with since last year. And from her story, we found out that her increase in number of customers, especially on payment of bills and utilities, they're very thankful that she still remains open, and that her the village store, or what we call the sari store, is still accessible. So when they visit her store, it's not just essential goods that they're taking, but they're also making the financial transactions needed for their homes. An average household remits about 3 to 4 times a month locally, and that helps, and with a community agent present, that helps them maintain that access of funds, especially for sending money to those who are outside their village, or to their relatives that are located far away, or another province. So I'd like to invite folks also to visit more, to learn more about the story of Jenny by visiting our website. We do have a blog written, and she has given her own words as well on how being a community agent not just affects her immediate household, but her family and the villagers around her as well. And I think she's a story of hope for us, because by by still remaining active in this time of COVID-19, not only is she helping those who immediate villagers, but also by making transactions, remittances for those who are far away. They continue to have access to these funds. So do visit the website of Grameen Foundation, and you can visit her story there.
Thank you so much, Christine. I had one additional question. How do you go about in the Philippines identifying the most vulnerable people for the cash transfers? What's your approach to that?
So we actually have like a pre-selection list and the criteria that we agreed upon with the microfinance institutions. So this includes having information on their access to if they're currently accessing a loan or service to the finance institution. We're also asking a series of questions, including what type of shocks they've experienced, environment, income shock, if they have a loss of business, or if their household member or main household member has experienced a loss of income this time of COVID-19, if there's a death of the family, or if there's somebody who got sick in the family. These are just some of the questions. We also, because microfinance institutions have initially put in place what they call a targeting tool, including income tests or progress out of poverty index scores that they've incorporated for their targeting. We also look at those scores to see if these are the people who really need it the most, who really need the support the most. And we look also into the state if they are currently receiving benefit from their government or other agencies. And we currently also get their mobile number so that we can register them later on to receive SMS campaign, to be part of the SMS campaign, so that they can receive information via text, which is the fastest way that they can get information now, and for health tips and financial reminders, so that they can know how to respond to COVID-19 and how to better access financial services that are located in their area.
Great, great. Thank you so much. Having that information presented through mobile devices, both to people and about people, is really what makes it all happen very, very robust, very quickly, and very agilely. So thank you, Christine. Thanks for being up so late with us. But, more importantly, thank you for all your amazing leadership in the Philippines. Please do, folks, visit the website about, the story about Jenny Gromo, the community agent there. Thanks again, Christine. I'd like finally to introduce our new Executive Vice President for Global Programs, Brent Chisholm. Brent comes to us having been in our family for some time. He has been the CEO of TaraWorks, and he continues to play that function, but now he's also managing all of our program staff around the world. Brent, welcome. Can you give a little bit of background, about yourself and about the work that you were carrying out or are carrying out currently with TaraWorks?
Great, thanks, Steve, and thanks to everyone for joining us today. As Steve mentions, I've been involved with TaraWorks for about the past 3 years. TaraWorks was a social enterprise that Grameen set up a few years ago to help organizations by providing software for their field operations, customer relationship management software. And so we've grown quite a bit over the past few years and are now working with more than 60 organizations, about 17,000 agents across 48 different countries. And so we've seen a kind of a wide range of impacts from this COVID crisis. I have a Silicon Valley technology background, and so part of what interested me about Grameen was its history and track record of using technology to make a difference in the emerging world, and that's not something that you see very often in Silicon Valley. So that was a great fit. Prior to TaraWorks, I was living in Tanzania, working in the mobile payments ecosystems there in Kenya, Tanzania, Uganda. And so Grameen's just been a great fit of trying to use technology to improve lives in emerging markets. And so it's been my privilege to join the team and help out.
Thanks so much, Brent. I want to talk about, ask you about our work in Uganda, but before that, can you talk about how TaraWorks and other digital tech platforms that we use in Grameen, what are they, how are they being used now to make a difference, particularly during this pandemic period? It's really a crying need to reach out to people remotely, and what's happening? How is it making a difference?
Yeah, well, so TeraWorks was built primarily for field agents to use in interperson interactions in the field. So obviously, most of the organizations that we work with who have large teams of field agents are trying to rethink about how they can go about their business. And so we've seen several different areas of experimentation. Some organizations are very successfully using SMS messaging to complement their traditional outreach. So we work with a great cook stove organization called Proyecto Mirador in Honduras, and they use SMS messages as part of the interaction with the customer who's receiving the cook stove, both to schedule the agent visit to install the stove and the checkup afterwards. So we see organizations thinking about what things did we used to have agents do in person that maybe we can use as SMS messages instead, or perhaps just a phone call. So that's kind of one area of experimentation. We also increasingly have been working with life-enhancing consumer products companies that are operating supply chains. And many of them are thinking about how can we adapt our supply chain to minimize the number of interactions needed to deliver a cook stove, so that you can trying to ship a cook stove or a solar lighting system or a biodigester direct to the customer, rather than having to go through many more interactions via a warehouse system. So we've recently created an add-on module to manage supply chains called TeraWorks Enterprise, and so we've been working with several organizations to try and streamline that. And then the other area that's we're seeing a lot more experimentation with is in mobile money. So organizations that have to make payments to people are looking to that may have paid them in cash in the past, particularly in Africa, where digital mobile wallets are very widespread, looking to say, how can we move some of these transfers that might have been cash handed over in person, and can we move that over to mobile money? And the big challenge there is actually an information challenge. The mobile payment integration, the technology standpoint, is fairly straightforward, but there's a whole lot of reasons why a transaction can fail. And so what you need is an information management system to track the payments that were successful, but then follow up on the ones that weren't. So those are kind of the innovative organizations we're working with, the areas where they're trying to rethink how they do their operations and do things more digitally.
Great, thanks so much. I'm also very, very keenly interested, I know everybody will be, on the work that we're undertaking now in Uganda, in particular in West Nile refugee camps. We've spent some time previously in the Bidi Bidi camp, but that's an emerging great area need for us. Can you outline some of the things that we're doing in the Bidi Bidi camp and with refugees in Uganda? Yeah,
absolutely. So we work primarily with South Sudanese refugees in the Bidi Bidi camp, also a second settlement called Palarinya. Both of those are located in the West Nile region of Uganda. And the people that we have leading the project, both our Uganda team and our Washington-based tech support team, have sort of pointed out several things, that refugees are just generally susceptible to a variety of shocks, unexpected shocks, and resilience is a big issue. COVID is just one of many shocks that they have to overcome. And so the strategy of trying to help build up their resilience is one that is applicable to not just COVID, but other things. COVID's a little bit different from other shocks because unlike an individual sickness or a death in the family, it affects the entire community, not just one particular individual. So the focus in that work has been really on building resilience and self-reliance through savings groups. We're working with a local microfinance organization there, the Rural Microfinance Initiative, to help the savings groups that they work with both create pools of savings that they can use for what we call microinsurance and helping people through with emergencies, but then also connecting those savings groups to other financial institutions, banks, and the microfinance community as well for access to loans. So that's been one area of work. Another area of work has been around enabling digital financial services agents who can provide financial services in the communities, because these communities are not currently or haven't been well served in the past by those networks. And so trying to increase the number of agents in the area who can provide services and access to cash and other things. And then finally, we are working on a cash transfer pilot similar to what Prabhat and Christine laid out. That's going to be specific to Uganda. And we're hoping to launch that later this month. The planning is underway. And so we're hoping that in June we'll be able to tell some similar stories that you heard from Prabhat and Christine about the impacts that we're able to have in these refugee settlements for the women in the savings groups.
Great. Brent, thanks so much. And, thanks for taking on this enhanced role in Grameen Foundation, during a pretty challenging time. Really, it's been a great honor to work beside you and Christine and Prabhat. So thank you guys very, very much. I wanted to add just a few things to the conversation. Of course, we've spent an awful lot of time ensuring that we're educating our staff, our community agents, and local communities about ways of preventing the disease from spreading around physical distancing, around hand washing in particular. We're doing our best as well to equip all of our staff when they do have to interact and move in public spaces to have all the personal protective equipment that we're able to give. That's really been key to us. But the mobile platforms have really assisted us in getting the message out and ensuring that folks are safe. We're also very proud of expertise that Grameen Foundation has developed during the Ebola crisis that allows us to provide information and support to field workers to prevent the spread of Ebola, as well as to support clinical trials related to Ebola vaccines. And we're currently in discussions now about how to expand that work, in the COVID-19 emergency. So, once again, I wanted to thank, Brent and Christine and Prabhat for participating today. Thank you, Kate, for pulling us all together, and Princia for pulling us all together for this conversation. Thank you so much for joining. And we want to move to questions and answers if we can. Kate, are you tracking them?
Yes, Steve, thank you. And I just want to point out to everybody calling in, there is a question and answer function within the Zoom webinar. So we've gotten a couple already, but please feel free to type in any questions you have, and we'll try to get to as many as possible. To get started, we've received one question ahead of time, and this has to do with our work with smallholder farmers and how they may be affected by changing market rates and production risk during this time. So can you talk a little bit about how we have worked and are working to educate farmers about how to manage some of those agricultural risks and how we're helping them overcome them during this time especially?
I'll do my best to address that. We're very proud of work that we've done with smallholder farmers in a variety of crops in many countries, with coffee, with cacao, with coconuts, with maize, with rice, in different places. And that work really builds on our expertise in applying technology to help farmers improve productivity adopt good practices and help them get access to loans to grow their work and access to markets. So the first thing, of course, is getting the message out about being safe and healthy and adopting healthy behavior at the time. And our field workers are able to do that and get that message out. That's critical at this time. But then the second part is really ensuring that the information continues to flow about where markets are open, where markets are working, where there are good prices for farmers, to find, for their crops, and how they can continue to link at the right times of year, for the financing, that they need for seeds and fertilizer and labor costs as they do the work. We're anticipating, there's a lot of discussion at the moment about how disruptive this emergency will be to food, to agricultural value chains. We're already seeing it, of course, in a number of instances globally, here in the US, et cetera. But we believe that by keeping farmers linked to information about the markets, about good practices, and about where they can get loans, that mobile enablement actually can help to reduce the person-to-person exposure that farmers are facing and find solutions through good access to information. But we're very, very concerned about what's going to unfold over the next months. Kate?
Great, thank you, Steve. Another question is from Pavitra. What initiatives are we taking to work with self-help groups in India, especially during this time?
Prabhat, are you still on? It's very late. I know you may have.
Yes, Steve.
Okay, thank you.
So, yeah, I mean, in the Indian situation, of course, in this program, our effort is to reach all the most vulnerable and excluded people facing any kind of vulnerability. So we're not specifically looking at self-help groups, but many people who we are supporting may be part of self-help groups, and many may not be. If you look at self-help group model, you find that there's some people who get excluded from self-help groups. Like migrant workers are not able to participate in self-help groups, and they are really badly affected at this point of time. People who are old age, above 60, 65, their participation in self-help group is very small. Whereas in the current situation, we really want to make sure that senior citizens are not left without any support. People who are disabled, are facing disability, also are excluded from self-help groups. So in this initiative, really our effort is to reach out to most vulnerable and excluded populations. In our mainstream programs, of course, we do look at self-help groups, like Steve mentioned about the Grameen Mitra program that we are undertaking in multiple districts in Maharashtra. There we look at self-help groups for things like promoting financial education, digital financial literacy, and offering self-help group members an opportunity to embrace these new digital platforms and giving them access to a wider range of financial and non-financial services so that they can improve their lives, save, invest, and create assets. I hope that answers the question.
Yes, thank you, Prabhat. Yeah, we have another question from Ashok, and he's asking about the role of corporate responsibility during this time. So I'm sure we could hear from a number of you. It looks like Prabhat does have a comment for that as well.
So, yes, this is a time when everyone, both corporates as well as individuals, need to really be as generous as they can be, because just the sheer number of people who are affected by the COVID crisis, and I mentioned before, it's both the health crisis as well as an even bigger economic crisis. So it's time for everyone to really open up their purses and open up their hearts and support everyone around them. We have seen corporates, coming and supporting in multiple ways. A number of corporate CSRs are supporting things like distribution of personal protective equipment amongst the health workers and distribution of free food. But I must say that there's a lot more that needs to be done, and there's a lot more that corporates can and should do. This is not the time when you look at your statutory obligation to donate 2% of your profits towards the CSR contribution. this is an extraordinary time. And through this platform, I would really like to urge all the corporates and corporate CSR heads to do as much as they can and not restrict themselves to the 2%, which is the statutory requirement. Though I must acknowledge that, of course, they are doing their bit, but of course, the situation demands much more.
I just like to add, it really is critical what Prabhat is saying. This is the time when, on a global scale, there's going to be such suffering, and it really is critical for all of us to think about what we can do. We're very grateful at Grameen Foundation to have a number of, really inspirational corporate relationships. I'll give a shout out in particular to our friends and colleagues who are on the call from Capital Group. The Capital Group has been a long-term supporter of Grameen Foundation. They've developed, a major staff, initiative to support our work. They come annually to see our work in the field. We're so proud of the relationship that we've been able to develop with the Capital Group. And I think, more than anything, I'm hoping that we're able, and our staff in the field are able to be, true partners with groups like Capital Work to truly make a difference. So that's critical now for all of us.
Great, thank you. And Christine, I don't know if you have anything to add from what you're hearing from some of our partners in the Philippines?
Yes, sure. I mean, we have a term in the Philippines called bayanihan, and that means coming together and uniting as for common purpose and for common goal. I think that spirit of bayanihan is so much alive during these days. And coming from our partners, each one is trying their best to either try to give immediate support by providing food to frontliners, health kits and mask distributions, even funding support to those who are senior citizens and individual entrepreneurs. I think the efforts here in the Philippines for a corporate, it's very varied depending on your location and depending on the industry that you're part of. We're seeing also some businesses that they're starting to give off free rent for the past few months, those who are affected by the situation, or discounting some of the rates for either their fees or their transaction rates, which helps. But I think there's still a lot of room for improvement and a long way to go, especially if this situation continues for a longer period of time. So it is testing a lot of our patience and also a lot of our consideration. But having organizations and nonprofits, not just Grameen Foundation, but others as well, and coming together to unite for these common purposes, it gives us a spirit of hope that there's still good news and good faith that is coming around in these situations, and we're keeping faith and we're hanging on, especially at difficult times.
Great, thank you, Christine, and all of you. Another question from Alice. She says that Grameen has had such a scope of knowledge and experience, as we've talked about on this call. It's a little bit of a follow-up to the last question. Are there any other examples of partnerships with corporations or maybe some of our other nonprofit partners where we are working to share learnings and best practices, either on the financial side, the work with Ebola, or any other examples you might have?
I can jump in on this one. We're one of the things that we've been developing is a sort of curriculum and training set for women entrepreneurs in emerging markets called Resilient Lives and Resilient Businesses. And we've actually been working with one potential donor who I'm not able to name, but who's interested in helping us bring this curriculum to microfinance organizations in a couple of different countries. And so that would be a case where we've developed the curriculum and need to change it to suit each country. But it's directly about how can we help women entrepreneurs make their businesses be more resilient specifically in light of the COVID changes. So that's been super exciting, and there's a couple of other discussions underway about bringing it to a couple of markets beyond that. So I think that's just a great potential. Similarly, the system that Steve talked about earlier, the mobile training support service that we've been using for our Ebola trials in the Ebola project, we're in discussions with another partner to adapt that system and use it for COVID health messaging as well. And I think both Pravat and Christine are looking at using that system as potentially a messaging tool aligned with the COVID unconditional cash transfer program. So definitely seeing a lot of corporate organizations who are supporting work in these areas, thinking about how can we take the existing tools and make them COVID aware and sort of expand their scope. So I'm very excited about the corporates that have stepped up already to do this, and hoping more will.
Thanks, Brent. And I would be remiss if I didn't mention, our amazing initiative called Bankers Without Borders, which is not just banking. It's really involves professionals, over 21,000 professionals on our database who provide, pro bono technical support in agriculture, in banking, in technology, in organizational development, et cetera. And, a number of our partners on this call, have been very active in that. And that's a way that, of course, we benefit and our partners benefit from the expertise that those experts bring us. But, we also view it as a way, to open up, understanding and participation, in this core mission of addressing poverty and hunger. So it goes both ways, and we're very proud of all of the corporate and all of the professional involvement we have with Bankers Without Borders.
Okay, thank you. I think we have time for one last question. Dr. Deepika has asked something that Prabat briefly touched on, but maybe you can go in a little bit further, talking about daily wage earners and contractual workers in India, some of whom are not able to access cash transfers as they don't have a Jan Dhan account. Hopefully I didn't say that too wrong. What initiatives are you seeing the government or other agencies can help provide for them?
So, Jan Dhan account, which is mentioned, of course, is a huge thing. In India, there are over 320 million Jan Dhan accounts have been opened. So, which means that almost all, not 100%, but close to over 90% of the households have at least one member who has this Jan Dhan account, which is also linked to their unique identification number called Aadhaar number. So, it's kind of very possible to send out payments to almost most of the households in the country today. Of course, I can't say that all households have a Jan Dhan account. You also have a large number of undocumented migrants living in India, and they do not have Jan Dhan accounts. There could be other households who may not have opened the Jan Dhan account so far. So, of course, in those cases where somebody doesn't have a Jan Dhan account, the only way to send them any remittance or any transfer them any benefits is by local groups. So it could be local civil society group. Like where I live, I have seen a lot of migrant workers are here, and some of whom are undocumented workers. And in those cases, I have seen the local resident welfare associations really pooling in resources and buying food and giving them food, giving them cash. So that kind of thing is happening, and that's really, really good to see that generosity coming from ordinary people. That, okay, I have had food, but what about somebody else who has no income and no food? But I must mention that the investment that the government has made in terms of getting all of these 320 million Jan Dhan accounts open and setting up these robust digital platforms has made it so much possible and easier for us to leverage these platforms and reach almost any part of the country instantly and in a very, very efficient and scalable manner. And that's where I think the mobile app that I was referring, the Grameen for Giving app, which works on identification. So once we have the right beneficiary identified, then leveraging these digital platforms and sending them cash transfers in real time is very doable. But I acknowledge that in some cases, the domestic workers may not be getting paid, or somebody, some of the informal workers may have lost their jobs and may have no income left. So of course, that is definitely something to be concerned about.
Great. Thanks,
okay,
everybody.
thank you, Prabhat.
Yep.
And Steve, before you conclude really quickly, I want to point out to everyone calling in that we have posted the link to the conversation with community agent Jenny Gramo. The link to that is in the chat of the webinar here today, if anyone would like to access that.
Thanks, Kate. And I just like to say, we do have a number of other chat questions or comments, and we'll do our best to reach out to everybody to respond, to those specific issues. I just want to thank you all for joining. It's really an honor for us to count on your support and your interest and concern. Thank you. Thanks to the team here for pulling it all together, Kate and Princey in particular. And thanks, for very late evenings for joining us, Prabhat and Christine. Brent, thanks so much for being a part of this. Much appreciated, and be safe, everybody.
Thank you, and keep safe.
Stay safe, stay sane.